Hello, my name is Gabrielle Abdelmessih. I'm campus editor of the Oakland Post and columnist of A Grizzly's Guide to a Healthier You, our public health column dedicated to discussing health topics and how they relate to college students. I'm honored to be interviewing Dr. Abdul El-Sayed, a physician, epidemiologist, former Michigan gubernatorial candidate, and author of 2 books, Medicare for All, A Citizen's Guide, and Healing Politics, A Doctor's Journey into the Heart of Our Political Epidemic. Both great reads, by the way. Welcome, Dr. El-Sayed.
Yeah, thanks for having me.
So to give our readers a little background knowledge about you, you were born and raised in Metro Detroit. You graduated from undergrad at the University of Michigan and gave the 2007 commencement speech in front of President Clinton. You completed your MD at Columbia. You were a Rhodes Scholar. I mean, wow. What you did and the work you did to get there is remarkable. And, you clearly have the intellect and ability to excel in any field in medicine. Why did you choose a career in public health?
Yeah, my motivation for a career in medicine was in large part because of my grandmother. She was the wisest, most intelligent person I've ever met, but never got to go to school. She grew up in mid-century Egypt, where at that time, the combination of poverty and misogyny and colonialism robbed her of the opportunity to have an education. And part of the consequence was that, she had 8 kids, 2 died before the age of 1. And I wanted to be the kind of doctor who could protect kids like them and people like her. When I'd visit Egypt, where my parents immigrated from, every summer I'd travel about 15 years in life expectancy. And the crazy thing is, I didn't have to go 15, travel 10 years life expectancy in 15 hours. I didn't have to go 15 hours to go 10 years in life expectancy. I could go 15 minutes from where I grew up in Oakland County to the city of Detroit and travel the same life expectancy gap. And so for me, I wanted my career to be about doing something about that. And that's why I became a doctor. And ultimately, through my studies and my training, I came to appreciate that in so many ways. While there are some amazing doctors who do amazing work in our healthcare system, unfortunately, the way that we have decided that we're going to allocate medical care is part of the problem in our country. And so I wanted to be the kind of doctor who worked on the system rather than in the system, which led me to a career in public health, which of course is about all of the things outside of clinics and hospitals that made people sick in the first place: the air that they breathe, the water that they drink, the communities that they live in, the way that society allocates resources, whether or not they have a good home that is stable, whether or not they're being policed by overzealous government officials, whether or not they have a community that respects them and protects them. All of those things shape people's health in ways, and so I wanted to be a part of addressing that.
Well, given your work and your educational background, it's no surprise to you that we've just gone through and are still going through one of the most divisive and confusing times in US history when it comes to the intersection of politics and healthcare. In your experience, what is the most profound way that politics and healthcare policy and healthcare delivery intersect from both a positive and negative perspective?
Well, I mean, I think we're living through it. We're living in a time that is defined by a major pandemic, which is arguably the worst in history, in recorded history. And at the same time, while we've been able to amazingly innovate a vaccine in less than a year, we're coming up against the fact that one of the oldest technologies is getting in the way, and that's public trust. Right? Do you trust the people around you? Do you trust the edifices of government? Do you trust the systems of science? And unfortunately, too few people do. And so, in some respects, it is amazing that we have a vaccine as fast as we do, and it's also amazing that upwards of 30% of adults still haven't gotten fully vaccinated yet. So I think we are watching as policy, politics, public health collide in a pretty profound way. And at the same time, right, I think so much of that is comes back to the nature of our public conversation, right? If public trust is sort of the oldest technology on which the idea of society, the idea of civilization is founded, then you have to ask, why do so few people trust? And I think in a lot of ways it has to do with the nature of our public conversation, which has been balkanized by a system of social media that monetizes our eyeballs to make large corporations a lot of money, and so disincentivizes the folks who produce misinformation that attracts eyeballs from being able to post and move that misinformation. And so it has undermined the public trust in a time when, ironically, we should be able to move information faster and with more a higher level of rigor than we ever have before. But that's not what we're seeing. And so it's a reminder that the system of corporate capitalism that we live under, that it has some really profound costs. And I think one of them has been the public trust in an era when, ironically, information should be easier to get than ever before.
Well, in your book, Medicare for All, I do have a copy right here. You talk about how people, or you talk specifically about people organizing to change hearts and minds, and that led to the Supreme Court legalization of same-sex marriage in the United States. And how do you change hearts and minds regarding the presence of health disparities in the United States and the problem that it presents, and that reducing those disparities is beneficial for society?
Yeah, I mean, I think it's both easier and harder now, or in this particular case, than in the example that we talked about in the book. That I think is a really great example of how organizing can really move a public conversation. On the one hand, everybody experiences healthcare, every single person, and you don't have to go very far to appreciate how our healthcare system fails people, whether it's 67% of all personal bankruptcies in America, or just the experience of having to fight your insurance company for healthcare you already thought you paid for. And in the midst of a pandemic, there are big questions about why did our healthcare system fail so immensely, both from the preventive side, on the public health side, and then also in the curative side, and the fact that we suffered more deaths per capita than any other country in the world. And so in some respect, people have their own experiences to draw on. And on the other side, there is a vested interest in maintaining the status quo because it makes people a lot of money. And they will work really hard to push back against any of that organizing through paid advertising and other means of trying to influence the public debate. And at the same time, right, I do think that the example that you brought up of marriage equality offers us the opportunity to remind ourselves that actually we have to keep pushing. And in the end, the point that you made about equity is important because, for folks who do have rather relatively reliable health insurance, it would be easy to just step back and say, well, in a rigged game, I'm winning. And so why should I care about the game? And, I don't want to live in a society. I don't think any of us should want to live in a society where we know our sister or our brother doesn't have access to something as simple and profound and critical as health insurance if they get sick. And I think that is the responsibility that we bring to this, is to say, look, for those of us who have power and are winning in this particular rigged game, we have to ask ourselves whether or not we want to be winners in a broken game, or whether or not we have the responsibility to ally together, all together, to guarantee that access to health insurance and health care for every person in our country, because it's just a right and it's the right thing to do.
When discussions about the or one hears the discussions about the rise of healthcare costs in the media, it's rare to hear how the cost of a professional degree has risen sharply in the past 20 years. It can cost well over $500,000 to get an MD or DDS degree. And, I think accompanied with that rise in tuition is the stagnation of reimbursement rates from insurance companies, and the rising costs of operating a hospital or a private medical or dental practice that have not been proportionate to the rising cost of a health education. Do you think that institutions of higher learning or insurance companies play a role in healthcare disparities?
So, you look at that. So to answer the second question and then speak to the first piece of the question, there's no doubt. I mean, the health insurance industry is a big reason why we have the kinds of health disparities that we have in our country. We have a tiered system where if you are low income, you get worse healthcare. The reimbursement for the care for your body is lower, which implicitly means that we value that body lower than we value the body of somebody who had money to pay for a better insurance plan. And that is fundamentally inequitable, and it patterns the kind of healthcare that people get to receive if they get to receive healthcare at all. Of course, many people in our society, in fact, 10% of our society does not have health insurance, and we cannot forget that. I do think that the cost of training is an important issue here, insofar as I think you're seeing a sort of imbalance in the kind of disciplines that physicians choose after they graduate medical school, because they want to pay down their loans. And that's why, in our book, Medicare for All, we argue that actually the training of a physician ought to be a public good. It's something that we ought to pay for. And that way, right, the worry about whether or not they're going to be able to pay loans off is something that people aren't having to consider when they're deciding what kind of physician they want to be. And wouldn't it be better if we had more pediatricians and psychiatrists and family care practitioners than the number of cosmetic dermatologists that we often have, one being far more lucrative than the other. And so, yeah, I do think that is connected, but it's a secondary issue relative to the fact that health insurance makes about 15% off the top of every dollar we spend on health care. The CEO of the largest insurer in Michigan is making nearly $20 million a year, and that's all money that people paid for healthcare. Right? They thought that money was going to pay for their healthcare, not going to line the pocket of some CEO somewhere. And so there are bigger picture issues that I think we have to pay attention to, even beyond physician training costs. But that's an important one insofar as it plays pretty large in the minds of people who are making decisions about the kind of career that they want.
Well, also in your book, Medicare for All, I noticed, and especially reading your books or through previous interviews, following you on social media and your campaign to run for governor, through those platforms, I've noticed that you are very intentional with your words, and I was pleasantly surprised by a particular choice you made in a sentence in the book. I'll read it for you, if that's okay. It says that if history is any guide, a serious push for Medicare for All will require a president who makes Medicare for All a significant piece of her platform. Can you elaborate on the pronoun that you chose to describe a future president?
Yeah, I mean, I think it is rather absurd that in a country that purports the values that we do, that we have not yet had a non-male president. And I think that is something that we're due up for. And I do hope that, when she is elected, she is a supporter of Medicare for All. And I think, the broader point here is that in some respects, the challenge that we have in the United States is that so many of our elected officials do not represent the people who are most in need of representation in our political system. And, you think about the fact that, we've never had a non-male president. And it forces you to reckon with the fact, well, then what proportion of our country has never been represented in the office of the president, let alone, when you think about diversity by ethnicity and race, when you think about diversity by socioeconomic position, when you think about diversity by gender and identity, when you think about all of these ways that these things intersect, you realize that we are just behind, and there's a lot of work that needs to go into empowering a more diverse political class, and also making sure that people who are in office are representing and fighting for the needs of people who are poorly represented in our society and disempowered because of it.
And lastly, you are a staunch advocate for young people getting involved in politics and mobilizing societal change. And to the young people like myself that are pursuing a career in medicine, healthcare, or any other field that intersects with public health, What, in your view, should we be mindful of when considering the inequity of health and healthcare in the United States? And what tangible things can we do at this stage in our education?
Yeah. Well, I think most importantly is be involved, and be involved in ways that are thoughtful and focus beyond one's own career, but are really about advocating for folks who don't have the same kinds of fortune and the same kinds of opportunity that you do. And that means, I think, being intentional about building community beyond the sort of organizing factors of our lives. We tend to engage with people who are very similar to us. And I think one has to be really intentional about saying, you know what, I'm going to think beyond my own demographic and really try and build communities that are inclusive intentionally. And if you can do that, then I think you can harness that experience and that intentionality into the kind of organizing and the kind of leadership that we need in society. And when it comes to healthcare, there's nothing more profound to any individual than their own health. You start taking that away from people, even in small pieces, it becomes overwhelmingly the most important thing that they think about every day. And so bringing an empathy for that and a recognition of what we ought to have and what we would want if we were born in different circumstances without the same socioeconomic opportunities. And if we were born on the wrong side of marginalization in our society, what do we want for the society to offer everybody and to be fighting for those things. But the truth is that young people have a really profound sense of right and wrong. And I think society tends to try and move that and erase it. And so don't lose sight of that, right? And I think, some of the best political advice I ever got was from Bernie Sanders, one of the oldest politicians to run for president. And he said, never lose sight of where young people are. And, it was ironic because he said it to me and I was 33. And, now that I am a father myself and, I'm closer to 40 than I am to 30, or closer to 50 than I am to 20. I appreciate what he meant by that. And at the same time, I also appreciate that, I'm fathering a 3-year-old and the world that she's going to live in is the world that you all build for her. And so I hope that, you never get jaded and you never lose the inspiration of believing that you can be a part of making this world a better, more just, more equitable, more sustainable place. And so I'm grateful to you, and I'm grateful to all the folks out there fighting for the world that they want to live in, that they want my daughter to live in, one where people do have their healthcare, and maybe we do elect finally a president that represents the other half of our country that's never been represented in that office. And I believe in you all, so I'm excited for that future.
Well, we're just getting started, but very well said. And thank you so much for your time today.
Yeah, it's my privilege.
All right.